You start the Wegovy injection, the pounds start dropping. The clothes fit better. Appetite? Gone. But then, a sharp pain in your right side. Maybe after a meal. Maybe out of nowhere. And now your doctor says might be your gallbladder. What? How does weight loss affect that? And why did no one warn you? Let us talk about the gallbladder risk with Wegovy, how it happens, what symptoms to watch for, and what you can do to protect yourself before it becomes a problem. First, what is the gallbladder? It is a small organ tucked under your liver. Its job? Store bile, basically, your body's fat-digesting fluid. When you eat, especially fatty food, it squeezes out bile to help break things down. But here is where it gets tricky. When you lose weight quickly, especially with medications like Wegovy, your body processes fat differently. Bile can become more concentrated. It sits in the gallbladder longer, and that increases the chance of gallstones forming. In fact, one of the known side effects of GLP-1 agonists like Wegovy is cholelithiasis, which literally means gallstone formation. And yes, it is listed in the prescribing info. Now, gallstones themselves are not always dangerous. Some people have them and never feel a thing. But when they cause a blockage or inflammation, that is called cholecystitis. And that is when the pain kicks in. So, what does that pain feel like? Usually it is a sharp cramping pain in the upper right part of your abdomen. It can show up after a fatty meal or even at rest. It might radiate to your back or right shoulder. Some people also feel nausea, bloating, or notice changes in stool. If you feel that more than once, or it gets worse over time, do not wait. Call your provider. Gallstones do not always show up on standard blood work. You may need an ultrasound to catch them. Now, what increases your risk? Rapid weight loss is a big one, especially losing more than 3 pounds per week. A low-fiber diet, dehydration, and skipping meals can also make things worse. And women are statistically more likely to develop gallstones than men. So what can you do to prevent it? Here's a quick checklist. Stay hydrated. Your gallbladder needs water to keep bile flowing smoothly. Eat small, balanced meals. Do not skip meals. Even if you are not hungry, add fiber leafy greens, oats, berries. Include healthy fats like olive oil or avocado in small amounts to keep the gallbladder active. Watch the pace of your weight loss. Slow and steady is safer than aggressive drops. Some doctors also recommend ursidil, a medication that can prevent gallstones in high-risk patients. That is usually for people who lose a lot of weight fast, like after bariatric surgery, but it is worth discussing if you have concerns. If this helped you feel more prepared, or if no one told you about this before, like the video, it tells the algorithm this is info people actually need. Coming up next, insurance. Why Wegovy gets denied so often and exactly how to fight back. Subscribe so you do not miss it. And if you have already experienced gallbladder symptoms while on Wegovy, what did it feel like? What did your doctor do? Drop it in the comments. You never know who it might help.